Bismillahirrahmanirrahim. Assalamu alaikum. Here is Khadija Muhammadi, BP 1650104, presenting clofazimine to Ms. Shahana Wahid, PhD 705. The overview of clofazimine. Clofazimine is a phenazine dye and it is used in the treatment of leprosy. Leprosy is a chronic bacterial infection caused by Mycobacterium leprae. It affects the nerves of the extremities, the skin, and the lining of nose and upper respiratory tract. It is usually used in combination with other anti-leprosy medications such as dapsone. The indication, the clofazimine is indicated in leprosy. There are different type of leprosy, but the major two types of leprosy, that is tuberculoid leprosy and lepromatous leprosy. The patient with tuberculoid leprosy have limited disease and relatively few bacteria in the skin and nerves, while lepromatous patient have widespread disease and large number of bacteria. It is also indicated in renal transplant and vitiligo. Vitiligo is a long-term condition where pale white patches develop on the skin. It is caused by the lack of melanin, and melanin is the pigment in our skin. Different types of leprosy. In that, I have mentioned multibacillary leprosy because the case I had studied and I presented is related to multibacillary leprosy. Uh, in lepromatous or multibacillary leprosy, nodules, papules, macules, and diffuse infiltration are bilateral, symmetrical, and usually numerous and extensive, with involvement of nasal mucosa that lead to crusting, obstructive breathing, uh, and epistaxis, that is the nose bleeding. The contraindications is diarrhea, peptic ulcer, vomiting, and steatorrhea. Steatorrhea is the presence of excessive fat in feces. Stool may become bulky and difficult to flush, have a pale and oily appearance, and can be especially foul smelling. The side effects are diarrhea, GI bleeding, bowel irregularity, bowel obstruction. Our drug crystals can be deposited, nausea, vomiting, anorexia, abdominal pain due to bowel obstruction or bowel irregularity, pruritus. Pruritus is an unpleasant sensation of the skin that provoke the urge to scratch. Pruritus may be localized or generalized and can be occurred as an acute or chronic condition. The skin and hair become discolorated, dry skin, dermatitis, acneiform, and phototoxicity. Phototoxicity is a condition in which the skin or eyes become very sensitive to sunlight or other form of lights. The dose for adult is 1.4 to 8 milligram per kg once a day per oral. The dose should not be given to pregnant mothers because it has been assigned to pregnancy category C by FDA. Patients suffering from renal dysfunction, uh, means renal compromised patients. Patients suffering from hepatic malfunction, means any type of enzymatic imbalances, and neonatals, newborns. Pediatric dose adjustment is 4.166 milligram per kg once weekly or as recommended per oral. In normal renal and hepatic functioning geriatric patient, means 60 plus, the dose should be 1.4 milligram per kg once a day per oral. The rational use is the combination therapy that is used to prevent emergence in drug resistance. Clofazimine used in capsule form with a strength of 50 to 100 milligram depending upon the weight of the patient. Dapsone used in tablet form, 25 to 100 milligram strength. Rifampicin used as capsule or tablet with 150 to 300 milligram of strength. Its irrational use is when we don't use it in combination. Its dosage form is gelatin coated capsules, comes with the brand name Lamprine. Pharmacoeconomics, Lamictal, uh, the 30 capsules of Lamictal of strength 100 milligram is of 1856 Pakistani rupees. Lamprine, 30 capsules of strength 100 milligram comes in 500 Pakistani rupees. Lomogin, 30 capsules 100 milligram of 455 Pakistani rupee. So economically, Lamprine is economical. Lomogin is also economical, but the stable form and the stable brand is Lamprine. The alternative of our drug is ofloxacin of 400 milligram strength. Can be used daily, means 24 hourly per oral, but this is for adults. The study shown this alternation for adults. The toxicity information regarding the clofazimine is not available yet, or no specific data is available yet, but overdosing can be occurred. So to avoid it, or if it is induced, then GI decontamination can be done via gastric lavage, or induce emesis, means to induce vomiting. Our drug interactions are many drug interactions, but the major are activated charcoal, that is charcoal; adrenaline, that is epinephrine; augmentin, that is amoxicillin; Benadryl, that is diphenylhydramine; Cefargot, that is caffeine; Cipro, that is ciprofloxacin; Claritin, that is loratadine; Altrazine, that is levothyroxine; Estrogel, that is estradiol; Ferrusol, that is ferrous sulfate; heparin sodium, that is heparin; valproate sodium, that is valproic acid. Now we have a case of 34 years old woman from Mexico. She is mother of 2 children, including infant. She had stopped smoking several years ago and appeared to be well nourished. She complained of a persistent pruritic rash throughout her body. Her symptoms started 5 years ago with cramping and spasm of her arm. She noted that her wrist felt like they were falling asleep at times, along with needle-like pain that would occasionally erupt. Uh, Additionally, she reported a significant amount of fatigue and stress. The patient revealed that she had worked with flowers extensively several years ago while in United States. And the physical examination revealed numerous lesions throughout her body, including of her nasal bridge area, cheeks, abdomen, and back. These lesions were macular in nature and didn't exhibit significant palate dryness or significant discoloration. Her sole of feet appears to be usually dry, and her legs appear hypopigmented when compared to the rest of the body, and her eyebrows appear to have started thinning. Biopsy is done of skin lesion on the abdomen and reveal acid fast bacilli. Her blood pressure is raised to 150 by 93 mm of Hg, and her white blood cell count is raised to 10 raised to power 12 into 10 raised to power 9 per liter of the blood. So our subject is a 34 years old female. She is married and she is mother of two children including infant. She is well nourished. Uh, our objective is that the skin biopsy is done of the skin lesion of on the abdomen uh, and revealed acid fast bacilli, and her BP is raised to 150 is to 150 by 93 mm of Hg, and her white blood cell count is raised to 10 is to 12 is to 10 raised to power 9 per liter of her blood. So it is assessed that she is diagnosed with multibacillary leprosy after complaining of a persistent pruritic rash throughout her body, and she had worked with flowers extensively several years ago in United States, which presents a possible exposure to the Mycobacterium leprae, that is M. leprae bacterium. Physical examination include lesions on neck, abdomen, back, cheeks, etc. clearly indicate to leprosy, and the patient is counseled about leprosy. The plan we had is a course of multi-drug therapy combining dapsone of strength 100 mg per day, clofazimine of strength 50 mg per day, and rifampin 600 milligram per monthly, and this is prescribed for 2 years. So rifampin is prescribed per monthly, so rifampin dose is supervised in order to assure any type of adverse effect or any type of thing leading to toxicity. LFT is done to ensure the hepatotoxicity uh, that didn't result from her concurrent use of any other medication related to leprosy. Thank you.